Hello, I'm Dr. Jim Meadows. I'm the Director of Palliative Medicine for Tennessee Oncology, and today I'd like to talk to you a little bit about palliative medicine and how it differs from hospice care. Now, palliative medicine is a relatively new specialty in healthcare that's gaining a lot of momentum, but people have had some reservations about participating in palliative medicine because they get confused with it versus hospice care. Palliative medicine is a specialty that is team-oriented, and the approach is to alleviate suffering in patients that are dealing with serious illness. Similarly, hospice care does focus on alleviating suffering in patients, but it's reserved for patients that have a prognosis of 6 months or less. Palliative medicine came out of hospice care. In fact, what was happening was that patients would be put on hospice and they would get attention focused on them to alleviate their suffering, see how they're doing, how are they coping with their illness, how are their symptoms being controlled, how are their family dealing with things. Basically, an overall, how are you doing? And not so much focusing on what disease you have, but who you are. And what we discovered is that patients started responding so favorably to hospice care, they started saying things like, well, why in the world did I have to be put on hospice to get this kind of attention? And that's an excellent point. So out of that movement came the idea that palliative medicine should be placed earlier on in the course of an illness, and thus the palliative medicine specialty was formed. Now, what we've discovered over time is that when patients participate in palliative medicine, along with their other providers treating whatever illness they have, such as cancer or heart failure or whatever their disease is, that they actually do better, and in many cases they live longer. And because of this, it's really caused palliative medicine as a specialty to gain momentum very quickly, and that's why it's becoming such a hot topic right now. And that's why it's important for patients to really understand that palliative medicine, although similar in focus to what hospice care does, is not hospice care at all, and in fact is there to make sure that patients get the kind of attention, support, symptom relief, and that their families are supported as well as they're dealing with a very serious and complicated situation. I hope this helps clarify some information for you, and if you feel that you or if a loved one would benefit from having a palliative medicine specialist participate in their care, please talk to your doctor so that a referral can be made. Thank you.